Hi, girls.
Good afternoon, ma'am.
Yeah, good afternoon. Hi, okay, so all set, right?
Yes, ma'am. The speaker will join us in a while.
Okay, sure. Okay. Sharida. Once a speaker joins, then we will click immediately. Okay, we'll you all core members and myself, we can switch on the video and click it. Later, let us start with the webinar, and then in between and all, every clicks, no, you can manage with that. Okay.
Okay.
Okay. Okay. Let's wait. Invocation song, all those, everything is ready, right?
Yes, ma'am.
Yes, ma'am.
Sure. Okay. Yeah.
Good afternoon. A warm welcome to one and all present here. The Red Ribbon Club College, the Red Ribbon Club of Ethiraj College for Women presents you the webinar on COVID do's and don'ts. I like to share a quote by Benjamin Franklin: "An investment in knowledge pays the best interest." I request the core committee members alone to switch on the video for a picture. Now we will embrace our event with the Tamil Thai Valthu.
நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் மதனமென நிகழ்வரத கண்டமிதில் திக்கணமும் அதில் சிறந்த காவிடனல் திருநாடும் தக்க சிறு விரை முதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் வணங்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திரும்பியும் திசைய மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Now, may I request Aishwarya, the president of Red Ribbon Club, to deliver the welcome address.
A very good afternoon to one and all present here. I take immense pleasure in welcoming you all to RRC's very first event for the academic year 2021-22. The Red Ribbon Club of Ethiraj College for Women was initiated in the year 2006. RRC is a social service club that is for the youth and by the youth. With about 3,000 registered members being a part of the club, it has strived to spread awareness on HIV and other social issues, offer help to people in need, and enrich the student community with values and understanding over the years. RRC has never failed to offer value, and our very first event, COVID Do's and Don'ts, caters to the need of the hour. Now, I request Srinidhi, Joint Secretary, to welcome our speaker for the day.
Our esteemed speaker for the day is Dr. R. Madhumita, family physician and diabetologist, currently working as a consultant in the Department of Internal Medicine and Health Check in Manipal Hospital, Bangalore. Our guest is also an active philanthropist, educational speaker, and humanitarian. She has volunteered to enormous causes and has spread awareness among the general public. More often than not, she lends her expert hand to treat and educate rural people of Tamil Nadu through health camps. She has started her medicinal career in the year 2005. Even as an intern, she was very proactive and helped educate and treat people in the rural parts of Nepal. She has also helped patients in de-addiction and TB centers and has worked in St. Martha's Missionary Hospital. Post MBBS, she pursued her PG in family medicine in Delhi under Diplomate of National Board. To add to her long list of merits, she has also done her certification in diabetology from the prestigious Boston University. She is particularly interested in handling infections and volunteered to serve during the SARS epidemic in Delhi. Currently, she is working tirelessly with the utmost dedication in the front lines and serves the country by treating COVID-19 patients. She is also one of the active voices to spread information and awareness about this pandemic. We are honored to have you here to address the students, ma'am. We welcome you, ma'am. Now, we will begin with the webinar. I kindly request ma'am to take over.
Thank you, Ms. Srinidhi and the Red Ribbon Club. I'm really, I feel honored to be a part of Etiraj presentation webinar. The reason being, Etiraj is very close to my heart. This is the alma mater of my mother. So I'm basically from a joint family. So I have got values from everyone, and my mother has been a pillar. So I'm really very happy to address the young adults of Etiraj. My mom is a very strong woman, so I believe every single person over here is going to be a very strong lady in the future. All the best to you all. I'll not waste any more time, and we will start with the presentation. It would be more of like, what you should know rather than the medical point per se. I'll just share my screen. So, COVID 19 per se, as you all know, it is a virus. So, basically, COVID 19 is not just any virus, but it is it was one of the what we say is a virus that we never addressed, never paid attention to. So, what is so specific about this 19 is it causes respiratory distress. That is, it causes a fall in oxygen level. Oxygen is very important for breathing. So, once that is reduced, your life, like, the what should I say, the breathing stops within few minutes. And even if you don't lose your life, oxygen is needed for your brain and other parts of your body to function properly. So this, you can say, it is some say that COVID-19 doesn't exist. Let me tell you honestly, seeing so many patients, it does exist. It is not something that is created because of politicians or international war or anything. Some say it's a biological warfare, maybe it is. And some say it is leaked from the lab, maybe that is also true. Or it is just a naturally, a mutation that has occurred to that innocent virus. So whatever it is, it does exist. So there are different types, alpha, beta, gamma, delta. But the thing that we should know is, if any of your relative has alpha virus, that means this virus has a potency to multiply 7 times more, and it is going to transmit 7 times more. So the chance of you acquiring the infection is 7 times more as compared to other types. That is those innocent types. Coming to the Delta virus, it multiplies even faster, 20 times more than your Alpha virus. And Delta plus is more virulent. What I mean by virulence is the chance of it causing a much serious illness where you require hospitalization, where you require oxygen therapy, is more with Delta plus virus. So I have shared one of the oldest classification when COVID-19 had come into picture, where we used to call it mild when there is hardly anything. Patient just has a flu and then he is completely asymptomatic. So these days we have categorized mild and common into a category called as mild or asymptomatic. A part of this comment goes into moderate category as well. So basically what you need to know is people who are asymptomatic and people who have mild disease, that is they have fever, cold, cough, but their saturation is okay, they have loose motion but their bp is okay, they are walking, talking, those people are mild. Moderate is someone in your family or your neighborhood whom you have noticed who are deteriorating. Why I'm telling you this classification, though you are not into medical field, is you are the young adults. Your family is going to look at you to help them shift to the hospital. You are going to be the primary caretaker. So kindly just pay a little bit of attention to this classification alone. In the mild and asymptomatic group, you don't have to do much. You just have to give them adequate hydration, take care of them. Whereas in the moderate category, where their oxygen is dropping slightly, their fever is persistent, they have diabetes, hypertension, their oxygen level is somewhere in 92 to 93, but not decreasing further. They would be requiring a place called hospice or a general, like, the basic ward of the hospital, where it's only monitoring, where they don't deteriorate further. So here you will be contacting the helpline number, telling them that you have a family member or a neighbor who is diabetic, hypertensive, renal disease, or any other health issues from before, and their oxygen level is like this. They are having persistent fever, they are having loose motion, they are losing their consciousness, or sometimes they are normal, sometimes they are not responding to you properly. Then you please call the helpline, help them shift to the hospital. Severe is those who have high respiratory rate. Like, you can visibly see that they are panting, they need oxygen. Their oxygen level is going less than 92 and it is persistently going down. They have to be shifted and they need oxygen. These patients just require oxygen and steroid, they don't require more. And those who become unconscious, where they are not putting out urine, they are not responding to you, they definitely need an ICU admission. So here you just have to triage them and you call the helpline number and tell them what exactly it is, so that they can allot the necessary bed for that particular patient. So what you can do when a patient is there with COVID in your neighborhood. And just Ms. Aishwarya, I think the president, as she has mentioned, you people are from a social service point of view, you are attending this seminar. So in COVID care, what you can do is, first thing, when you have mild to moderate, basically the mild and asymptomatic are going to be 80% of patients. 15% of them will be requiring hospitalization, but they don't need anything further. The other 5% in that, 4% will require ICU care, but they will come out majority of the times. 1% is the one whom we are doubtful about, who will require proper ventilator support and then shift to HFNC and other care. So your role in COVID care will be when any of your known to, be it a patient who is your relative or a neighbor or someone who has approached you because you people can help them. In that case, you tell them, first thing is they will isolate themselves in a room. They will stay there for 10 days, but they will keep in touch with their family members every day, every 6 hours, once at least, irrespective of their situation. Whether they are doing good, not good, they have to communicate it. So how they are going to communicate? It is through WhatsApp calls or bottom calls, Skype calls, whatever electronic gadgets and app they are comfortable with, they will be keeping in touch. Second thing is, tell them to hydrate themselves extremely well. Minimum will be 4 liters of fluid that they will take. And related to the medicine that they are going to take, plain paracetamol has to be taken at least 3 or 4 times if they have fever. And the third thing of it is their toilets. They are going to use a separate toilet, because in their sweat they secrete the virus, in their urine they secrete the virus, in their toilet they secrete the virus. So every time they use the toilet, tell them to use plain Lysol or Harpic, whatever is available at their home. They just have to pour few drops and then flush it, and that toilet will be used by them separately. Let's say that they stay in an apartment and the balcony is facing the outside world. In that case, they can open the windows so that aeration and sunlight is good for them. Next comes their food. They need to take protein rich food. So if they are vegetarian, explain them that they can take more of milk proteins. Curd is a good source. In vegetable source, they can take a lot of pulses. Any dal is good for them. Non-vegetarians and vegetarians can definitely take egg. In non-veg, they might not be able to tolerate very well. Their GI system would be upset. They might develop loose stools. So tell them that they can have fish soup or fresh chicken soup. Nothing more than that. Coming to their discarding the mask. Every 6 hours once, they will discard the mask. When there is no one around them, they can remove the mask and keep it aside. They will have to monitor themselves 4 times a day. They have to report to their family member their pulse, their saturation level, if they have developed fever or not. The family member should maintain a chart and report to you so that you can contact the healthcare worker or the helpline number. Next comes the post COVID care. Once they have recovered, what all they should do? First thing is they have to do deep breathing exercise, whether their oxygen level is normal or not. Irrespective, they will be doing breathing exercise for 3 months. This breathing exercise can be Aloma Viloma, or it can be plain pranayama, or if they don't know any of these, Kapalbhati can be done. If they don't know any of these, no worries. Just tell them to count 5 for inhalation, 5 for holding, and 5 for exhalation. That is more than enough. Their toothbrush has to be changed the minute they recover from the viral illness. They don't have to get their COVID test done after 10 days. Like August 1st, they are positive. August 10th is the date of recovery for mild to moderate. If they are admitted and they are discharged from the hospital 7 days from the date of discharge, you will consider. So August 1st, the patient is discharged, then August 7th is the date of recovery. So that day, they are going to change their toothbrush. If they are using soap, they will have to discard that soap and use a new soap. If it is a body wash without loofah, no problem. If they are using any loofah, then they'll have to change it. Coming to the curtains, bedspread, the clothing that they have used, plain washing with normal soap powder, the detergent that they regularly use, but it has to be washed separately, not with the other family members. They just have to sun dry it for minimum 4 hours, then it can be reused. The whole house can be fumigated. Coming to the caretaker per se, there should be just one person who comes, delivers their food during the COVID time. They will have proper gloving of both the hands. They will use mask. They will leave it at the doorstep and the patient will take it. Now coming to the cutleries that are used by the patient. First thing, if it is a disposable thing, you just put plain bleaching powder, leave it for a couple of hours, then you give it to the sewage worker who comes to collect the garbage. If it is your household utensil that you're using it, then let the patient wash it with plain water, keep it outside. If you can provide them with any dishwasher, well and good, let them wash it. If they're not in a condition, no problem. Let them leave it outside. You take it, you wash it, sun dry for 15 minutes. You wash your hand with soap and water. After that, that is enough. Nothing more to be done. Vaccination, there are so many people who are scared of needles. Kindly, when they are injecting you, you look away. You can relax your arm by wherever they are going to inject you at the injection site. Before you go inside, just massage that site and then you go inside. You don't have to worry about it. That is the relaxation technique. So remember one thing, your needle size is smaller than any, even the normal pencil and pen that you use. So it is just going to be a few seconds when they jab. You won't even realize it. So you please think it is better to get a needle than to, put your life at risk. Now coming to the vaccination per se, is it important? Yes, it is important. Why is it important? This virus has something called as gene sequencing. What I mean by that is, let's say my father's gene is safer for COVID, whereas my mother's gene is not, and I have taken it. So there is a chance that my mom and I would end up in ICU as compared to my brother who has taken my dad's gene and my dad going to an ICU. So this vaccination is going to protect me and my mom. We cannot do gene sequencing for every single person in India, or let's just forget India, all over the world. Any country with a minimal population also, we cannot go and do the gene sequencing. So in India, currently we have 3 vaccines that are available. All 3 of them have 2 doses. Sputnik, it is basically where you have another virus in which we have incorporated this virus and we give you. Majority, we have found that it is very effective and it doesn't cause too much of side effect. Based on the side effect profile, what we have observed is our own Covaxin is the best. It is a killed virus. If you have a lot of allergies, you have medicine allergy, food allergy, and all, the vaccine for you is Covaxin. It is a killed virus. And Covaxin is the best for all of us in one way, that is, it is the whole virus that is given to you. So, whatever mutation it takes, still you will be protected. Coming to Covishield, the spike protein is the major cause of virulence. Virulence means the severity of your infection. So, the more the mutation, this spike protein is what is going to mutate. As of now, they have done 13 mutation, and that is what they have given to us to protect us. So, all three are safe. You can take them and you can educate everyone else who is in and around you to take it. Majority of you are 18 plus, so you are all fit to take the vaccine. Next question comes that, ma'am, I had an asymptomatic infection. Can I take the vaccine? I have not been vaccinated ever. Yes, you are fit to take the vaccine. Let's say your date of recovery is August 1st. Then you can take the vaccine after 3 months. That is on December 1st, you are fit to take the vaccine. Let's say you had the vaccine first dose. After that, you developed the infection and you recovered. In that case, November 1st, you can take the vaccine. It is 2 months later from the date of recovery. It is a simple thing. You will have some amount of immunity during this period of time. That is the reason we are delaying your vaccination, nothing else. So the recovery, you can say that we have heard doctors say that our relative has recovered, but still I notice my cousin coughing even today. I notice my uncle who is having chest pain on and off. There is a relative of mine who gets on and off fever. There is someone who is still tired. Yes, despite recovery, there is something called as post-COVID sequelae. The common ones are cough. So if you notice any of them, tell them to take cough syrup, tell them to do breathing exercise. Despite that, if it doesn't settle, tell them to meet their physician. Chest pain, they have to go and meet the pulmonologist, physician, and cardiologist. The first point of contact would be the physician. Once their X-ray and their echo test shows normal finding, they don't have to worry, it is just muscle fatigue. For those who are feeling extremely tired, all they need is rest and plenty of fluids. They need to take protein-rich food that we discussed initially. Sleep disturbance is one common thing. So they have to maintain sleep hygiene, go to bed at fixed hours of the day, avoid sound exposure, light exposures at the time of going to bed, nothing else to be done in the bed. No work in the bed, no sleeping, except for sleeping, no eating in the bed. It should only be used for sleeping and fixed waking hours. Prior to sleep, they can go for sleep meditation. It is helpful. They have to put their work, it should be a proper work-life balance so that their sleep comes naturally. These are few things that we notice. And another thing is hair loss, weight loss. You will definitely gain back with proper nutrients. The patient would require multivitamin supplement if they end up noticing it even after 3 to 6 months of recovery. So what we mean by long-term COVID after recovery is it mainly occurs in people who have had severe COVID. Others, if they develop long-term effect, that means they have not followed what was told to them during the COVID episode. First thing is, if they have hydrated themselves properly during the COVID, they will not experience any tiredness after 4 to 12 weeks. Second thing is, if they have been following proper steam inhalation during the COVID time and saltwater gargling during COVID time, and after that, if they have taken vitamin D supplements and they have been doing proper breathing exercise, they will not experience. So these long-term effects will last for a period of time. But naturally, with routine exercise, regular walking, regular breathing techniques, regular pranayama, and other things, chest physiotherapy will be recommended for some. Steroid inhalers will be recommended for some for a period of time. So kindly let them take it. There are some people who say that it was not given to me, so you don't take. Every patient is different. So kindly, if anyone asks you for an opinion, tell them each of you are different. If the doctor has given it to you, kindly take it. Do not stop. If they stop, long-term complication is going to be there. If they don't, definitely their lung recovers and within 6 months they come back to normal self. There are very few patients who needed it for 2 years now. So I'm going to talk about other points which have to be taken care of in COVID situation. That is, this is for people who have not got a COVID, but who have been affected because of this pandemic per se. So basically, health has three components: physical, mental, and social. All three have to be fit for a person to live a normal life. So during this pandemic, everything has changed. All of measure on and off, we have lockdown. So this itself results in stress. How am I going to handle it? Staying inside a closed room for a long time is going to affect you. So many people who have their routine, like fixed time, they do fixed things. It gets affected, and that results in mental health issue. So you can plan the same. If you are a regular exercise person, then shift to at home stretch training, strengthening, and you can go for yoga, meditation. All these things will definitely help. Your friend might not feel the same amount of depression as you do. If you are feeling depressed, do not feel bad. Do not hesitate to call a psychologist. You can get an online consultation with a psychiatrist. That doesn't mean you are mentally ill. You are just preventing yourself from going to that stage. If you notice anyone in your nearby your near and dear ones, kindly encourage them. Fix an appointment for them. Let them speak to a psychologist or a therapist or a psychiatrist and come out of this. Post COVID or during COVID, many families have suffered from stigma, especially in the first COVID wave. You have had COVID, so people don't talk to you. So it is very important, once they recover, kindly treat them as one, and one, and you might also be in that place one day. So kindly encourage them to talk to you. If possible, help them out. So coming to jogging, yes, you can go for walking and jogging even if you have recovered from COVID. You can do all your exercise. You can go to gym. There is no issue at all, provided it is an open space. Second thing, you are following COVID appropriate behavior. What I mean is, instead of using N95, please use a cloth mask so that you do not develop breathing discomfort when you're doing an exercise. Or you can use a normal surgical mask because it has more pores for you to breathe, but it will prevent the particulate matter to enter your nose. Or you can do in your terrace, open space, where you can do yoga or strength training or some gym activities. Second thing is, people who are, this is not for you, but for the elders, your family members, your parents who will be around 40, 50 years of age, where their regular health checkup is needed. So fix an appointment for them, rule out the onset of diabetes or detect it at the early stage by fixing a health check appointment. Let them come home, take the sample, let your parents just go in the morning for 1 or 2 hours, get their treadmill test, echo test, or ultrasound, X-ray, where they have to go in person. Just do those and come back home and have a video consultation with the doctor so that the in-hospital exposure is minimal for them. There are some unfortunate people with kidney disease, with cancers, and who have a ruptured appendix all of a sudden, or they have to undergo a surgical procedure, or they have to undergo dialysis, they have to go for chemotherapy. Kindly encourage them, get a video consultation with their respective doctor done, and let them take a call. You can reduce the frequency. Maybe we can convert it into an oral tablet for chemotherapy. Surgery, we can control the infection and delay the surgery a little bit, or with high, with COVID appropriate behavior, the surgery can be done. Coming to diabetes, hypertension, heart disease, all these things, whatever medicines they were taking, they can be continued by e-pharmacy. You order it, let it come home, fix an appointment 3 months once with their doctor through online, let them do it. So social, rather than going and meeting your family members or your friends, have a e-connect so that you don't feel like you're not talking to any of your friends or your relatives. And one more thing that we have noticed is a lot of miscommunication about COVID goes through WhatsApp messages, Botan, Telegram, XYZ. So kindly help your friends. You please streamline it. You are the young adults. You have more potential and more capacity to control it than any of us. So kindly help us by reducing these, misinformation from spreading. So there are special circumstances where we have elderly, pregnant women, newborn, and also I'll just touch upon it where their care has to be given. First thing, let's say the infant, normally an infant who doesn't have COVID and an infant with a COVID mother and an infant who has COVID but his mother is not positive. These three scenarios we'll discuss. First one, all of them need all these things. The child breastfeeding, a child who does not have COVID, everything will continue as normal. The child will fix an appointment, get his vaccination done. He will be continued on breastfeed and complementary feed. His growth would be monitored, milestones would be monitored. Second is an infant who has a mother who is positive. Since he is in contact with the mother, he can continue with breastfeeding. His vaccination will be delayed for a month. So the child's mother has to do a video call and talk with the pediatrician. Growth monitoring and mental well-being monitoring can be delayed by a month or two, not hard and fast. Third thing is the child itself is positive. The infant itself is positive. Still, the child will continue breastfeeding from the mother because the mother is the primary caregiver. She is with the child. Maybe she has developed immunity while feeding the child. So it is not contraindicated. That is, you don't have to stop the mother from feeding the baby. The baby can continue. And coming to the vaccination part, it has to be delayed by at least 1 or 2 months. The pediatrician will be the best judge after seeing the child post recovery. So once the child is recovered from COVID, after 14 days, the child has to be taken to the pediatrician for a visit. Majority of the time, we admit if the infant is positive for COVID. Coming to the toddlers, here we will again divide it into three types. See, when we look at the toddlers, first thing is the most important. All of us have been going out and playing as kids. When we ask our childhood memory, when we were 3, 4 years, it was first thing everyone remembers is I did not cry when I went to my school. That's what my mom told. I used to play with my friends, or I cried and I created a ruckus when I went to school for the first time. Now these kids are missing it. Too much of screen time for them. So what you can do is you can encourage their parents because majority of them are working parents, both parents. So you can tell them that they can get a board game for them or inside the house or on the terrace, they can put a trampoline or they can put slide, swing, anything that is possible. If that is not possible, mind games are best. If siblings are around 2, 3 of them, stay together, encourage them to play in the terrace. Encourage them to play the childhood game that we used to play, like aeroplane or badminton. The child doesn't have to know how to play it properly, but it is a distraction. He or she will be occupied, except for the school time, their screen time will decrease. The vaccination will follow as before. If you think that the child has put on a lot of weight, kindly encourage the mother to take the child to their pediatrician. If you notice that the child has become skinny, encourage them to go and talk to the pediatrician. Vaccination will continue as before. If you notice the child has loose motion, abdominal pain, vomiting, head, running nose, kindly suggest the mother to take the child immediately to a pediatrician. For all that you know, it can be COVID. Growth monitoring and development monitoring can be done during the vaccination sessions. Special thing doesn't have to be done. One positive thing about toddlers is even if they have COVID, they recover very fast. Majority of them do not require any medicine at all except for plain crocin and cough syrup. They don't require any antibiotics. Nothing is needed. So coming to the social point of view, they stay at home all the time. Even if their parents are working from home, they are caught up with their system. And the kids do not know how to approach to the new technique. They don't know how to mute themselves, unmute themselves, how to answer their teachers. They are afraid of the screen. So they start showing temper tantrum. Sometimes it's just the maid who sits with them, or the grandparents also, they face challenge when they have to, like, now it's almost 2 years, so they have all been trained, but they do find some, every batch, every new batch, every year there is a nursery child coming up. Or it last year some schools did not provide online education. They have just started now for nursery, LKG and all. So they would be missing that. A teacher sitting in front of them and teaching them is different from a teacher who is coming online and teaching them. So they are majority of the time locked inside. As adults, we go outside to buy some vegetables, fruits, shopping, something or the other. But kids are always kept inside. They feel so lonely because the minute they come next to the parent, they just tell them, you stay there, I'm in a meeting. So these things have to be focused on. The parents and the uncle aunt, you must be the uncle aunts. So you people will have to take care of your niece and nephews. I'm not telling you spend all your attention on them, but at least give them some creative game. Just make them occupied so that they don't disturb any of you. At the same time, they don't feel lonely. Talk to them when you have free time. Adolescents, see, majority of the time that this is the age they attain their puberty. They do not know. So you people socially, you please volunteer and you educate them about the hygiene that they have to maintain during this their first periods and first few periods. Actually, they won't be quite confident about themselves. Make them realize whatever physical changes that they are noticing in their body, it's absolutely normal. They might have some temper tantrum. Please help them out. In rural parts of India, we are still noticing some amount of sexual transmitted diseases. The kids are not aware and they are being abused. So create awareness as much as possible. I know this is totally not related to COVID, but I wanted to put it across you so that you people can form a webinar or something on this, and you can help the rural part of India a bit. So coming to our the city dwellers, basically we are noticing increased case of RTAs. I know it's an alarming thing during lockdown. RTAs means road traffic accidents. They have to be minimal, but we are finding adolescent kids. Reason being mainly more of boys as compared to girls. So during the lockdown, they take the vehicle, they go with their friends, and they dash against any vehicle and every vehicle. During the lockdown time, of course, everyone travels with high speed. So that is what is causing this. Please educate them not to do this. Tell them to be responsible citizens. Half of them, they know how to, say internet issues, ma'am, and don't attend the class, but tell their parents that we are online, we are attending the class, and they misuse the internet. You know better than me what misuse of internet means. So again, people who are very sincere and attend classes, they sit down all the time because they have to get the best mark. 10th boards, 12th boards, JRE exam, and they have something called as NEET. They have a common entrance for engineering. All these things put so much of pressure on the kid. So he or she sits and they don't eat properly, don't sleep properly, don't do exercise properly. At least when they used to go to school, or when they were going for the preparatory exams, they used to shuttle, travel. Now that is also lost. So all these things have to be taken care of. If you have any of your cousins who are preparing for the exams or comes in this adolescent age group, kindly encourage them to go for at least half an hour walk every day, and to balance, make a proper timetable, and focus on their life normally. Coming to the mental health issues, definitely if a child has recovered from COVID, he or she has this major stress that I miss my class, and they go into depression. We have noticed staying at home, not having anyone to monitor, kids have taken up drug abuse. And there is a lot of gender bias. Recently, we had 2, 3 kids who came up with their parents because I am a girl, I have to do household work, but my brother doesn't have to do anything because he is a boy. Mind you, this is in the elite family where they are facing this issue. So, the least that you can do is kindly motivate every person you come across that it is a shared responsibility. The major stress that the kids are coming up with, we recently had a small, a 18-year-old boy admitted for the last 15 days because he is in a psychiatric ward, because he is worried about his career. He just yesterday he started to speak. Last 13 days he was mute, he refused to speak. So much of stress was inside that child. So COVID does not just cause issues related to, just the disease alone. Other things have also cropped up. And in adults, we have noticed that nutrition is a big problem, because from 9 o'clock in the morning to 9 o'clock in the evening, we are on call. We have to be there on meetings. So neither the husband nor the wife has the time to cook. So whatever is the quick thing, they do it. So it is not just for them, it is for the family as well. So they put on weight. This results in thyroid because you're an adult. So you're more prone to diseases as compared to young age, because your the nature preventing you from developing disease slowly wanes off with age. So hormonal issues like thyroid, diabetes, everything occurs earlier. Cancer has increased recently. We have detected a lot of cancer during this pandemic, mainly because of sitting in the same place, stress, increased smoking because I have a lot of stress, consuming alcohol because I don't have any other recreational activity, I cannot go out and meet my friends. All these has increased cancers. Staying inside the house, infection has thankfully come down because we don't eat too much outside. We are not exposed to others, so the infection is less. Infertility cases have increased. This is because this why I know you might be thinking this has nothing to do with us. Why are you talking about infertility to us? If any of your neighbor is planning a pregnancy or something and you see that they are undergoing hormonal therapy, first tell them that they have to reduce their stress level, they have to go for physical activity. That itself will reduce this risk. Exercise is a must. How much ever is the long work hour, they have to balance it. And another thing is, young adults and adults are the ones who have to take care of the elders or the kids. Be it with COVID, without COVID, you become the primary caretaker. So the fatigue is experienced in a lot of people. So instead, you can tell the small kids also to share responsibilities. Like, you can educate them to, you don't have to always go to them and give them their food. You can teach them to make their own bed. All these things will teach them responsibility, keep them occupied, and it will reduce your burden at work as well. So it should be a shared responsibility during the COVID times. Mental issues, yes, the mother goes. Domestic violence doesn't mean that you're going to beat someone. The mother feels overworked, so she abuses the kid in the sense, I don't want to talk to you. You don't have to, scold the child. Even a simple word from you can affect the child. you might be, this is for all adults. I'm just giving an example as mother. So you might have a deadline that you have to finish your project and submit it on a particular day, particular time, and you just came to know of it like some half a day earlier. So you will be working, and at that time someone comes to you, your mother or your father or your cousin, you get irritated, you just scold them. That's what I mean by domestic violence. It is just a simple verbal thing without any intent. When we stay in a closed environment for a long time, all of us do that. Some of you would have taken a part-time job because you are at home, you want to explore new stuff. Anyway, everything is online. Why not I try a new thing? That will also add stress. So kindly try to balance everything. And responsibility of other family members, what I mean is you try to take their responsibility, share the responsibility. It is not that there is this particular person, he or she only has to do. Please divide the work, because all of you have equal responsibility in your household now that majority of you are not going out. So this is one common thing that I want you to help out with. Every lady who is pregnant, please encourage them that they have to go to hospital or have a video call with their gynecologist and get their antenatal checkup done. They cannot deny it, saying that it is COVID time. If I go, I would get COVID. My child would be infected. Kindly tell them no, they have to go. Second thing, prior to planning pregnancy, tell them to take vaccination. After 3 months of vaccination, they can plan a pregnancy. Gynecologists have given the choice to the pregnant mother whether they want to take the vaccine during pregnancy or not is completely their wish. There are some people who have said that we don't want to take, we will take it post delivery. That is also okay as long as they follow COVID appropriate behavior, it is fine. Mode of delivery, normal vaginal delivery can take place. If a mother is COVID positive, then we prefer cesarean section only. COVID infection during pregnancy will be treated like a normal person. Only difference is that pregnant mother might have to be observed by us in a hospice or a COVID care center. This again depends on her symptoms. If she is COVID positive, she can definitely breastfeed. If the baby is COVID positive, they can definitely, she can breastfeed the child. Elderly, whether they have COVID, no COVID, they will be taking care of their comorbidities. Let's say there is one 70-year-old lady who has diabetes, hypertension, heart disease, and all these things. She has developed COVID. She will definitely take all her medicines. Along with that, we will be giving her COVID medicine. But she should be aware that she is at a high risk, and we might have to admit her even if she doesn't have a drop in saturation. All her medicines will continue. She cannot delay any care, saying that it's COVID time, I will not step out of the house. She doesn't have to step out of the house, but medicine has to be continued, and with the doctor has to be continued. One thing that we have noticed is staying at home post COVID, especially in elderly, we are noticing more of depression, psychiatric illness. Majority husband and wife develop infection together and one of them pass away. So it results in a lot of bereavement in the other spouse who is left, and they face a lot of issues. So if possible, try to give them as much love as possible. And last but not the least, kindly help your frontline workers, and you also be a part of them. Help us by joining some voluntary agency. And COVID patient, empathize with them. Please do not make them feel that they are not fit for the society or they are the culprits. This thing, I really want all of you to contribute. I'll just give you one small example. And these two people are from Bangalore. They are not doctors. Both of them are engineers. These two people have basically taken care of COVID from day one. What I mean by this is they have volunteered themselves to help us. They are boyfriend girlfriend. Majority of us think that boyfriend girlfriend means they must be enjoying, and in India we have a misconception: if they are boyfriend girlfriend, that means they are spoiling their life, they are going to ruin their career. These two have proved majority of our Indian thought process wrong. So this couple started helping us by forming an organization. In this organization, they started helping COVID patients initially. They have now branched out. Initially, they started with their college. In their department, they are triple E students. First year students, they started COVID Care Fund. They started collecting money from their friends and they started distributing food to COVID patients who couldn't afford. Later on, when their department, the news spread and the whole college came to know of it, all of them volunteered together and they divided Bangalore, parts of Bangalore, and started helping them not just with food, they also started helping them with ambulance services, shifting the COVID patients. Then it spread, and all over Bangalore, all the engineering college students came forward, and then it spread to other parts of Karnataka. So now in their organization, they just have to work. Each of them will be divided into teams. They will be grouped. So they take care of funeral services. Mind you, they don't go in person to any of these places. They just come in touch with the healthcare, the unit. That is, we have something called as the funeral services for COVID. So they call that helpline. They arrange for these people when there is a COVID death. They have the number of the ambulance service, so they arrange for shifting. They have helpline number for bed arrangement. They do that. Then they provide food. They provide home care isolation facility as well. So they have divided into 5-6 small groups, and now all over Karnataka, these students just have to take off on one day from their college. Once in 2 months, that is just one day you will be missing your class, and it is known to your admin. So your friends will be sharing your notes, and you get offline videos of whatever was taught in the class on that particular day. It is shared with that student. You don't miss your attendance as well. So you being the young adults, the future, kindly help us. Thank you so much for giving me this opportunity. If you have any doubts, please feel free to ask me.
Thank you, ma'am. There was an informative session, ma'am. Now let's get into the interactive portion of the webinar. Let's get answers to all of your questions. You may ask your questions now.
Good afternoon, ma'am. Ma'am, I'm Pavitra. So, I have a question. Does different vaccines give different kind of symptoms? Because, when I got my vaccine, my parents and we both got the same vaccine, which is COVID. But they did not get any symptoms, while I faced every symptoms that is out there in a book, everything. So it's how is it possible?
There is something called as immunogenicity of the individual. You could have taken your genetics from your parents, but that doesn't mean you have exactly just whatever is there in them. There is something that is your own component as well. As a young adult, your immunity will be better than them. So as soon as you took the vaccine, you would have responded by having fever, cold, cough, and all that. But your parents, with age, our immunity comes down. That was the reason in India, when we started the vaccination campaign, we started with elderly. So the majority of them did not have any symptoms at all. That is because their immunogenicity has gone down. So now that your parents have taken the vaccine, it doesn't mean that they should always manifest. Some people don't have any issues at all. They are completely all right. And another thing is, usually, our parent generation they have been in their childhood, after vaccination, they have to take crocin immediately and they have to drink minimum 4-liter fluids. So your parents would have followed it unknowingly. If you ask them now, they wouldn't even realize that they have taken it. So that would prevent them from developing any symptoms. So fluid therapy, there are so many of my patients who have taken vaccine and had 103 temperature. They just took one crocin. After that, they had hydrated themselves 4 liters within 6-7 hours, and they did not get a recurrence of fever or headache. So all these things also make a difference. And as you mentioned, each vaccine is different. With Covishield, yes, the side effect is more. Covaxin side effect is minimal because it is a killed virus. And with Sputnik, again, because it is on another virus, the side effect profile is slightly different and it is much lower. Just a minimal flu is all they experience.
Ma'am, also another question. Does having symptoms mean the vaccine is working or not? Like, is it a kind of indication?
No, definitely not. See, taking the vaccine and developing a symptom, yes, it is in a way, yes, you have developed symptoms, that means you have already responded. So in your case, it is 100% sure that you have responded. Just because your parents did not develop symptoms, that does not mean that they haven't had any, immunogenicity. I'll just give you one example. In Manipal, when we all took the vaccine, I did not have any symptoms at all. Okay, we did a test, antibody test, after 1 month of taking the vaccine. All my colleagues who have had, their antibody level was only 40, but mine was 50. I had the maximum. So I did not develop any symptoms. So having symptoms and not having symptoms does not mean that you do not have immunity. And there is another colleague of mine who did not mount the antibody at all. But till date, she has not developed COVID at all, and she is working in ICU. So she is at the maximum risk. So basically, what I mean is currently the antibody test that is available, it only identifies a particular type of antibody. There are multiple antibodies that are mounted. So you don't have to worry. Once you take the vaccine, you definitely develop immunity.
Thank you, ma'am.
Hi, ma'am.
Hi.
Hi, ma'am. This is Daphne, and I have a question that how long it will take to build the immunity after my vaccine, ma'am?
Minimum is 3 weeks after the first dose.
Okay.
Sputnik says that even after 8th day, see, we can say based on the, we have seen after Covaxin also on day 3 itself, there are patients who have mounted immunity. But when we talk about the efficacy in general, it would be for the general population where we have at least 60% who have developed immunity. In that case, it is 3 weeks after your first dose.
Thank you, ma'am.
Welcome.
Ma'am, I have a question. How sure can someone be that after getting vaccine that they are protected? Is it like there is a chance that I can also get COVID after being vaccinated?
Definitely, you can get COVID after vaccinated. Simple thing is, if you notice in the first COVID wave, we had more deaths. Whereas in the second COVID wave, we had more infections, less death. The reason is with vaccine, your immunity increases, but the virus keeps mutating. That is the reason, despite vaccination, we tell you to use mask, we tell you to use gloves and everything. Because the virus keeps mutating, but your life, you will definitely get infected, you will get a disease, but your life will not be affected. You won't lose your life.
If anyone has a question, I kindly ask that you may ask a question. If anyone. Now, I may request Ranganayaki, the Vice President of Red Ribbon Club, to deliver the vote of thanks.
Good evening to one all present here. It's not happiness that brings us to gratitude, it's gratitude that brings us happiness. Firstly, I thank the Almighty for making this session a complete success. I would also like to thank our beloved principal, Dr. S. Koday ma'am, and our vice principal, Dr. P. Shapriya ma'am, self-supporting for their constant support. I extend my hearty gratitude to our faculty coordinators, Dr. M. Renuka Devi ma'am, Dr. V. R. Shirley Grace Nimla ma'am, and Ms. R. Rajarajeshwari ma'am for guiding the club to excellence and eminence. I'm grateful to my core committee for their meticulous planning and execution. Last but not the least, I would like to thank each one of you for being such a wonderful audience. Thank you all.
It has to be the same, the first and the second dose. Like if you have taken Covishield, kindly go ahead with Covishield. If it is Covaxin, kindly go ahead with Covaxin. If it is Sputnik 5, then kindly go ahead with Sputnik 5 only. The thing is, each of them are different molecules. So if you take one and you take the other vaccine, then it becomes a problem. So that is the reason it is preferred to take the same one. Yes, there are scenarios where we have given one vaccine first and another vaccine later. It is in the cases where the patient has developed an allergic reaction or was intolerant to it. There are special scenarios where we do it, but in general, it should be the same one. Thank you so much. You've all been lovely audience. Thank you.
Thank you so much, ma'am. Let's conclude today's webinar with our college song.
request you all to kindly fill the feedback form to validate your participation certificate. So kindly, the link is put up in the chat box. Kindly fill the feedback form. We'll end the meet now.
Thank you.
Thank you, ma'am.
I request all the participants to kindly fill the feedback form given in the chat link to validate your e-certificates.